Hey guys, it's Trevor with the Brian Strength and Conditioning. Welcome to episode 4 of Whiteboard Mondays. Today we're talking about squatting and knee pain and all the things that you can do to work around that knee pain so you can keep doing that exercise, so you can keep doing that movement pattern that is very functional, it's very applicable to everyday life. So it's important that you can, that you know ways of kind of working around it. So in the middle here, we have the 5 modifiable factors that you can use to adjust that movement to make the knees more comfortable. And this is a very generic way of doing it, kind of covering a broad spectrum of pain. So it could be medial or lateral knee pain. It could be anterior knee pain, patellar tendon or quad tendon type pain, or posterior knee pain. So this might apply to you, but it also might apply to different people. So this isn't very specific, but just in speaking to more general terms, these are the things that you can do to typically work around most knee pain that you might encounter. So 1 through 5, we have technique, range of motion, tempo, intensity, and variation. So those are the 5 things that you can work with to change in some sort of way. And these go in order. So if you start to develop knee pain with a goblet squat, are there any technique faults that we're looking for? Do you have excessive knee valgus, which isn't necessarily a bad thing, but if it's making you symptomatic, then it could be a bad thing. Or excessive butt wink or lumbar reversal where your pelvis is kind of posterior tilting as you get deeper into a squat. If that is creating knee pain, then that could be of use to adjust. Foot position, bracing techniques, all of those kind of play factors into the kind of realm of the technique. Number 2, range of motion. So the deeper that you go into a squat, is that painful? Okay, let's do a box squat for 4 weeks. Let's continue to build up and load, and then gradually start to decrease that depth that you're going to, or increase that depth that you're going to get a little deeper and to kind of tease into that previously painful range, and slowly create that adaptation in those new ranges. Tempo, this is something that I use a lot in my rehab patients that I work with that have pain with squatting. This is a great tool to use. So a tempo adjustment of a 3-1-3. So you go down into the squat position, you take 3 seconds to get down into that bottom position, you pause for 1 second, and then you take 3 seconds in the ascent to stand back up. That will make things definitely harder, but sometimes just focusing on the descent and the ascent a little bit more creates more full body tension, which can help reduce some pain, whether it's in the low back or the knee too. So tempo, or utilizing different tempos, and that can be a 2-0-2, it could be a 3-0-3, a 3-1-3, like I said, or above and below that. So there's a lot of different ways to adjust that. Number 4, intensity, which is basically just the weight that you're holding, and the amount of sets and the repetitions that you're utilizing as well. So if you start to develop knee pain at rep 8, then build up in weight, but drop the reps a little bit, and continue to do that a little bit at a time, over time. And then those adaptations will slowly kind of build up in those rep ranges, and then you'll eventually be able to do more weight at that kind of higher rep range in that 8 to 10 zone. And then lastly is variation, and I put this the very last one because just because you have pain with squatting doesn't mean it's bad, doesn't mean you automatically have to stop doing it. And so this should really be your last kind of resort. It should be your last option, is changing the variation. And if all loaded squat, and this might be a little bit more applicable to the rehab patient or the post-operative patient, where loaded knee flexion just isn't an option and it should be avoided, then there are plenty of other exercises that you can be doing, but you just might have to hold off on that for a period of time. So this should, if it's not in a rehab patient, if it's not in an injury situation, or a post-operative patient, then variation should really kind of be your last resort. Is variation change. On the right here, I put, so just in regards to how much stress is being placed on the knees with specific loaded exercises. So you have your box squat is typically a lot less knee stress, and then your low bar squat and high bar squat, which are just different kind of bar positions on the back, and then the front squat, and then the overhead squat, and that is just from the demand of the anterior translation going over the toes from the knees. And so those are more knee stress at the bottom. And then over here on the left, you have your entry point. So if you are getting back into squatting following an injury, these are the entry points that will allow you to progress all of these things, but to progress down this list. So if you were initially having knee pain with a goblet squat, take a step back, try split squats. If that's painful, take another step back to reverse lunges, or to body squats, or to box squats. Slowly build up and load over time, and then work your way down the list, progressing in sets, progressing in repetitions, progressing in intensity, and then eventually you will build up to a barbell squat, whether that is low bar, high bar, front squat, or overhead squat. Probably not overhead squat, that's very technique oriented, but a low bar squat or a high bar squat is a perfect progression for just the general population, if you're able to tolerate it and if you've kind of gone through these appropriate steps. So I hope this gives you some insight into kind of working around knee pain with squatting. Happy Monday. Thanks for tuning in.